Is your child coughing frequently? Well, this is one of the most common reasons parents bring their children to the hospital. Hello, my name is Dr. Arzoo and I am a certified pediatrician. In this video, I will briefly explain the type of coughing in children, what parents should notice, and when a child needs urgent medical attention. Coughing in children classified into two types: dry cough and wet cough. Dry cough is the most frequently reported type of presentation. The most common causes of dry cough are viral infection, allergies, asthma, and exposure to environmental irritants such as dust and smoke. So, a wet cough is due to mucus production, which is mainly caused by infection involving the airways and lungs, which include viral infection like bronchiolitis and bacterial infection like Pertussis and bronchopneumonia, where mucus become more prominent. Never ignore your child cough. Sometimes it can be a sign of serious illness. Watch carefully for red flags such as nasal flaring, increased chest movement or shortness of breath, fever, refusal of oral intake, persistent cough with association of cessation of breathing like apnea, and blue discoloration of lips. That is called cyanosis, especially in small babies. If you notice any of these symptoms, seek medical advice immediately. And do not forget to follow the next video, as we discuss briefly the different types of chest and upper respiratory tract infection and their associated cough with real clinical cases. So stay tuned and thank you for watching.